22, 23-year-old. Came into the emergency room for a heroin overdose. He was brought in by an ambulance with the cops there. And, you know, when I approached him, you know, I let him know this is, the police had left the room, and he asked me if I was with the police, and I said, you know, I'm here for you. I'm not interested in talking to the police about what's going on with you. So when we set up the interview with him, he was at maybe a 5, and I said, on a scale of, you know, 1 to 10, how ready are you to get off heroin? He said a 5, and so I said, well, what would make this a 10? And he said, well, if I'm ever back in your emergency department, I'll know that I've got a problem. An hour later, he's back, and you know, and I just approached him. I said, "So you're back?" I said, "Help me, you know, help me understand this. If I remember correctly, one of the things that you had said was that if you're ever back in the emergency department, you said that would be a sign for you that you maybe you got a problem." And I asked him, you know, just where are you at with that now? And he was like, well, give me the information. And I didn't get him in, the liaison did. But it was a couple hours later, you know, his family was all on board. So we got him in. Yeah.
I think one of my favorite moments is when you get a patient that is defensive, and then the second you see them relax and you're together instead of, you know, the interrogator, and they say that you're there to work with them, it's the best moment.
One client that comes to mind is a gentleman who was referred to us by Department of Jobs and Family Services because he clearly was not job ready and needed to either be in the jobs program or working toward becoming job ready. And what happened to trigger them to refer him to us is that when he walked in for their first meeting, they realized that he was extremely anxious in a setting with other people. He actually told the worker that he hates people, that he'd had a terrible experience dealing with people in his lifetime. And then, so they referred him over to me. We worked a lot on the trauma issues. He had a history of childhood abuse, a lot of trauma throughout his life, and he's now at a point that he's looking into, or he's actually beginning to attend classes for job readiness. So he's really made some good progress, and that's kind of exciting to see.
I haven't had any big ones, especially since a lot of the referrals that I've made, I haven't had a chance to see them again or hear back about them. But when I do make referrals, and when people are really receptive and thankful for me being there, for talking to them, that's when I feel like I've had a success story. I haven't seen the outcomes yet, but just making that impact for them and making them feel comfortable that they've had someone to talk to is a huge accomplishment.
We had a couple come in. They were like 47 and 52, but both of them had been doing heroin for like over 20 years, and they both said they had infections on their heart from using the needles, and so they both agreed that they wanted to go into treatment together. And so we have a lot of people who will come to the hospital and say, you know, we offer this, whatever kind of insurance they have. And so we were able to get them into treatment, and I actually was able to do follow-up because they had to be admitted into the hospital, so they couldn't go into treatment until, but I was able to talk to one of the nurses from the floor, and she helped get them into treatment after they were admitted. So even though we didn't get to do all the work in the ER, we still were able to get them in. So it's nice to have outside resources, because sometimes our resources in Cincinnati are full a lot, and so we have a lot of reps come in from out of town and help us get into treatment. We've been successful with her. I think we had like 2 or 3 people or 2 or 3 instances where we've been able to get into treatment out of town, and that's helpful also.
He was just having a normal checkup at a doctor's office, and he is in the position where he has been working for over a year. He financially cannot really support himself, and it's really been bringing him down. He's depressed, and he just doesn't have the means to help himself. And I explained our program, you know, what SBIRT can do and our services out there, and he was very interested, you know, would love to meet with our SBIRT therapist. And when I gave him all the information, he told me and he said, I feel better knowing that I'm going to finally get help. So that patient left the office feeling better because he knows that he's finally going to have some treatment, you know, get the help that he's wanted for a while.
There was one person that came in and she just point blank said, had it not been for that paperwork that you all had me do, that SBIRT, I probably would never be coming to therapy. But I saw that I did have depression, and so I thought, well, what could it hurt? And she's still coming to see me.
Today, actually, I had a gentleman who just got off the IC unit because he had a major heart attack, and he was a positive audit. And he said that he used to drink pretty much daily until he said, I'm done. That scared me. He said I was in cardiac arrest. I don't even know how I'm here. So yeah, we got him set up with some outpatient AOD treatment where he lives, because he doesn't live in Sandusky, but he lives elsewhere. But we got him linked up with that, and we got him some lists of AA meetings, and he's super willing and super wanting to, you know, get into the right path, and he was so happy and so energetic and very, you know, appreciative, and he kept saying, I thank you so much. This hospital's been wonderful to me. You know, I don't think I could have actually been able to do any of this stuff, and I wouldn't be living without you guys.
Well, you know, I've had patients where they've referred them to me, and the provider's actually quite frustrated with them because they're maybe non-compliant with their medications. They, you know, complain a lot, you know, you're not helping me, all this kind of stuff. And then then this one in particular, you know, she comes and talks to me, and you know, after a couple of sessions, she's agreeing to, you know, start, okay, well, maybe I do need to, you know, address my diabetes a little more aggressively, you know, so she starts taking the medicine, and, you know, she starts asking about smoking, and the provider's like, really? You know, and then she comes back and does blood work, and her A1C's lower. Well, imagine that, you know.
I was working in the ED one day, and one of the nurses came and said, I've got a patient getting ready to discharge, will you see them? And I was like, you know, I had a bad attitude, and I was like, they're getting ready to leave. I was like, what do you want me to do? I probably can't do anything. And they said, well, they're here for heroin, and they're getting ready to discharge them. They're medically cleared. And I said, okay, I'll go over and see him. And this guy was 36 years old. The last 18 months, heroin had totally wrecked his life. He lost his family. He's getting ready to lose his vehicle. Had lost his home. He's living with his grandmother, who was there, and both of his parents were there. And the family really wanted him to get treatment, but I didn't know how much this guy was really invested. And he said that he really did want to go to treatment, and you know, he was ready to do something about it. So got on the phone and made some calls, and you know, the right insurance and the right location with an open bed and all that kind of fell into place. So we were able to do door to door and able to verify that he got there at treatment in about an hour and a half, and checked in, and they were doing their assessment. And so yeah, it was really cool.
She had scored high on the mood screening, had stated that, you know, she had thought about harming herself and had harmed herself in the past, but she wasn't thinking of it at the time. And when I was able to call her back and say, hey, have you been able to follow up with the agency you were trying to get with? She was like, you know, you are so nice. Thank you so much. You really helped that, because she didn't want to talk to me at first. And then she opened up and was grateful for it.
Like when I work in the hospital, I've noticed several times being able to look people in the eye and really see them, and they know that you see them and hear them, and being in the hospital is often scary, and you feel kind of like an animal sometimes. You get poked and prodded, but when someone comes in and they're just looking at you, eye to eye, and you're a person and I care about you, that's an awesome thing. I really enjoyed that.
I had a patient, a mom and a teenager. The teenager received a screening, and she had answered thoughts of suicide, and the mom didn't even know. She didn't even, that's not even why they were there. I spent about 30 minutes with them, and they now come to therapy, and they hugged me and we all cried, and it was great.